Just got back from the pharmacy. I pay $60 for a drug. Frustrates the heck out of me. I pay so much for healthcare and my premiums. Why'd I have to pay $60 every time for a drug I take every month? Hi, my name is John. I'm your healthcare hacker. In this episode of Healthcare Hacks, we're going to talk about pharmacy costs. So first off, I want to caveat this. This is only people with commercial insurance. What I mean by that is if you have Medicare, Medicaid, or any other sort of government program, what I'm telling you does not apply. But if you get insurance through your employer or the exchange, then pay attention because this will put money back into your pocket. The first hack is something I call manufacturer copay cards. What these are is if you take a brand name drug and you've got a large copay, many times if you go to the manufacturer's website, they'll pay your copay for you, or most of it. It's amazing. So how does it work? Well, first what you need to do is just Google your drug. Put in your drug's name, copay, card. That's it. A lot of these manufacturer sites will come up that then you have to give them some simple information. What's your name, address, etc. You fill that out, you get a card. Next time you go to the pharmacy, you give them your insurance card and they say you owe $200. You give them the copay card and the manufacturer covers it for you. It goes away. So instead of paying $200, you pay $5 or pay nothing at all. It really depends on brand to brand and how it works, but most of them, you can do significant savings. But a lot of us don't take brand name drugs, we take generic drugs. Most of us, when we have a generic, let's say we've got a statin to manage our cholesterol. We get that filled, we take our insurance, we pay a $20 copay. But there's products out there, and there's been a real revolution in the last couple of years with companies such as GoodRx, SingleCare, Honeybee, just to name a couple, that allow you to pay cash for less than you pay your copay, putting money in your pocket. The only negative is it doesn't count towards your benefits, so it won't roll into your out-of-pocket max. So it'll be outside of your insurance, but let me give you an example. I was recently working with a family whose teenage son was taking Adderall. Their copay through their insurance company is $120 a month. By using one of these cash coupon programs, they're able to go to the same pharmacy, get the same drug, the same exact prescription, everything's exactly the same, except instead of using their insurance card, they used one of these coupons, they paid $45 a month. I've even brought up the fact you can use mail order pharmacies where you can even get the cost even significantly lower than some of these cash coupon cards. So if you have a drug you take, and I tell people, general rule of thumb, if you're spending more than $30 a month, do two things. First, if it's a brand name drug, Google the brand name and copay card to see if the manufacturer offers a card. Second thing, if it's generic or if you don't find a copay card, put the name in of the drug and say coupon. Up will pop a lot of sites that allow you to search to see what the retail price is. It's very easy to do. It'll take you a couple of minutes and you can put significant money back in your family's pocket instead of paying the pharmaceutical companies. If you have questions about how to save money or problems you're facing with healthcare dollars, email us on the address on the screen.